Today, we'll be explaining in detail how to properly brush your teeth while undergoing orthodontic treatment. Because braces can easily trap food and plaque buildup is common, it's extremely important to brush your teeth thoroughly and correctly. An orthodontic toothbrush is different from a regular toothbrush in that the center bristles are slightly indented. This design allows it to fit around the brackets more effectively and clean them thoroughly. Of course, you can use a regular toothbrush, but using an orthodontic toothbrush makes it much easier to maintain good oral hygiene during treatment. Here's how to use the toothbrush. First, place the toothbrush horizontally so that it touches both the brackets and the teeth. Then move it side to side to clean the front surface of the brackets and the teeth at the same time. Next, tilt the toothbrush downward to clean the upper part of the brackets. Then, tilt the toothbrush upward to reach the lower part of the brackets. It's important to brush all three areas, the top, front, and bottom of the brackets evenly and thoroughly. Since regular toothbrush bristles can't easily reach between the brackets, it's highly recommended to use an interdental brush as well. Insert the interdental brush below the wire and between the teeth. Hold it at a slight angle, about 90 degrees, and gently move it side to side to clean the sides of the brackets and the spaces between the teeth. Be sure to adjust the angle to reach any recessed or indented areas between the teeth for a more thorough clean. One of the most common issues during orthodontic treatment is gum swelling and inflammation. This usually happens because people don't properly clean the area where the gums meet the teeth. When brushing your gums, angle the toothbrush slightly and brush in a sweeping motion from the gums toward the teeth. For the upper teeth, brush from top to bottom, and for the lower teeth, brush from bottom to top. If this feels difficult, you can also try gently placing the toothbrush against the gums and moving it in small circular motions to create a light vibration. The most important point is to thoroughly clean the gum line, the area where the gums and teeth meet. For the chewing surfaces and inner sides of the teeth where there are no braces, you can brush as you normally would. And don't forget to brush your tongue. The surface of the tongue harbors a lot of bacteria, so keeping it clean is essential for preventing bad breath. When braces cause irritation to the inside of your mouth or your tongue, you can use orthodontic wax to protect those areas. To use it, take a small amount of wax and gently press it onto the part of the bracket or wire that's causing discomfort. Rather than pressing it hard, it's better to mold the wax around the area by softly pressing and shaping it, almost as if you're wrapping the bracket. This helps prevent sores and allows you to go through your orthodontic treatment more comfortably. During orthodontic treatment, there are more hard-to-reach areas in the mouth, which makes it easier for dental plaque to accumulate. Plaque is a leading cause of both tooth decay and gingivitis. In particular, the areas around the braces are more prone to buildup because saliva doesn't reach them as well, reducing the mouth's natural self-cleaning ability. To prevent this, it's highly recommended to use a combination of an orthodontic toothbrush, interdental brushes, and in some cases a water flosser to maintain proper oral hygiene. Additionally, the longer food particles remain around the brackets, the more acidic the environment in the mouth becomes, which can lead to the erosion of tooth enamel. That's why it's important to brush your teeth thoroughly at least 3 times a day, and to make it a habit to rinse your mouth with water or use mouthwash after every meal. These simple practices can significantly help maintain good oral health during orthodontic treatment. Orthodontic treatment isn't just about straightening your teeth, it's a comprehensive process of managing your overall oral health. By following the proper brushing techniques we've shared today, we hope you can continue your orthodontic journey comfortably and safely.